I'm Dr. George Flinn, and I was recently reading the New York Times and ran across some articles that started me thinking. And on this episode of In-Depth TV, I'd like to discuss with you what I was reading, and it was about online, and it was about medicine. They started out talking about, and I've heard about this also, people being in an exercise class and feeling kind of weird feelings, just not feeling well, and having pains in the neck or pains in the back or pains in the shoulder. And it turned out this patient after patient, and I see the ones that come through the emergency room, they were having heart attacks or atypical heart attacks. Now, most of these patients are exercise people. They don't smoke. They watch what they eat. They low salt diet. But what happens is they find out that a level is off. Maybe cholesterol is very high. And patients get cholesterol lowering agents called statins, and they just don't pick them up. They just don't take them because of everything they read about the internet and statins and medicine. And what we're talking about is fake news. Now, not the fake news that we all hear about, it's fake medical news. There's a lot of misinformation out there in news, in politics, in world events. A lot of misinformation's out there. But this information causes a great deal of stress and strife. But the medical misinformation might have a much greater negative impact on all of us. Medical lies, that's what we'll call them. Medical prevarications. You'll find them, they spread much faster than medical truths on the internet. And they're hyped up, and people think, oh, this real discovery that, this medicine doesn't work, or this medicine works better, or you'll see all of these reviews, and they have very real repercussions. There are studies that show this medicine does this, and this medicine does that, and there's studies about statins, and they've, had studies about it, and they say that they work. But online, and I'm just taking this as an example, there are a lot of people that are fairly paranoid, and they're posting as if they were the truth. And a lot of people are out there selling something, selling an alternative therapy. And you find people that, you're sick, you want something, you want it fast, and you can probably get it overnighted to you. And so people buy into these alternative therapies, and other people they want you to click on their website. So these web pages and social media, they exaggerate the risk, and they drum up these unfounded claims saying that, all kind of things can happen to you if you take this medication or that medication, and all of the side effects. And there are stories out there that simply weigh the risk versus the benefits of medications. And a lot of patients will read these sales pages is what they are. They're not medically oriented, really, but they'll read these pages and think, oh, if I just take this supplement, or if I just take this natural ingredient, that it will help with these other things that are medically presented as sound. Well, false medication, false medical information can also lead to patients experiencing greater side effects. They say, well, how is that? Well, sometimes patients will benefit from a medication or an intervention because they believe it will work. Now, that's called the placebo effect. You've heard of that, where people take a sugar pill and all of a sudden they get better, and nobody can explain why. Well, there's a nocebo effect, what it's called, and it's just the opposite. And a lot of the internet, a lot of things that are out there, and we haven't vetted those. We don't know if they're true or fake. But patients can experience the side effects, the adverse effects of medications simply because they anticipate to feel that way. They can feel weird, they can breathe too fast, they can do all kind of things. They can get little itchy areas on their arms. You'll see these presented as if they were truths. And just take, for example, statins, the things that lower cholesterol. Patients, you see it online. You see statins can cause muscle aches. And you've seen that. You take the cholesterol-lowering pill, and you may have to stop taking it because you get rhabdomyolysis. That's a big term. It's muscle aches, and the muscles are attacked. But you know what was found out? They did several studies, some what's called blinded trials, where they gave people sugar pills and they gave them statins. And they found out that muscle aches were no more likely with the statins than they were with the sugar pills, because they found out that people were expecting muscle aches because they said, okay, let us know if your muscles ache. So remember, in clinical practice, a lot of people, almost 20% taking, statins, take that for example, report side effects. And a lot of people will just stop taking the drugs because of that. What else? Fake news. Well, vaccines. Vaccines are out there, and there are all kind of stories. The Centers for Disease Control, CDC, they found out that this is a viral story, that he was found in a river after he raised concern about the flu vaccine. And we have people repeating this idea that vaccines can cause autism. We have people saying that vaccines can cause all kind of things. And there's another study out there, or actually an article, it wasn't a study, saying that the vaccine for HPV, human papillomavirus, causes seizures and other side effects. And they reduce the rate of coverage from HPV from 70% to 1% in Japan. So people were so afraid of it that they didn't take the vaccine. Now, polio vaccines in Pakistan are frequently used by militants because they think the vaccine is intended to sterilize the local population. So, it's just very difficult to know what's true and what's not true. What I have seen is people go to their physician, their healthcare provider, and they can trust them. Online, you don't know if somebody's trying to sell you something. You don't know. They have an opinion. It may be just kind of drawn, pulled out of the air. They have an opinion that's put out there, and if it's in print, it seems to be so real. And people will comment on it. And just remember, it's their opinion. And sometimes they're educated and sometimes they're not educated about the medical aspects of therapies. What I thought was very interesting is I looked at one of these therapies that was for hepatitis. And I delved into it, and this doctor did this and this doctor did that. So I investigated the doctors. And there were 3, and one of them didn't exist. And one of them had a doctorate that he bought online. And one of them was a doctor that had lost his medical license for doing something, and I didn't even want to go into it any further. There's another big target out there. And these are publishers of medical misinformation. Cancer. Many people want to make money from alternative therapies. Some alternative therapies are okay. Some of them are accepted. Some of them have been proven to work. But which ones work? And which ones are you being sold something? Most people think cancer tumors are bad, and they actually think that cancer tumors are overwhelming your body. Your body's attempts to contain these harmful cells, your natural immunity. It's been said that online that surgery compounds the risk of spreading these harmful cells. I've had it. I've had patients tell me. I've had them tell me that I was fine until they did an operation and let air into the body, and then the cancer grew. Now, I know that's not right, but some people online warn that prescription medications cause the body to become acidic, therefore adding to the uncontrolled cancer spread. Well, I just have to take a deep breath. And, when cancer patients turn to alternative therapy, like diets, herbs, supplements, in the place of conventional therapies, they have much more likely to not do well. This is exploiting people's fears, and people that dissuade patients from getting evidence-based treatment should not be doing that. That's putting it mildly. Doctors and nurses, they frequently try to discourage their patients from turning to the internet for answers. And yet people, you and me, we continue to go to Dr. Google for symptoms and ideas about their medications because the internet doesn't require an appointment, doesn't require a wait. It's right there for you. And it doesn't require a copay, and it often provides information that seems very simple to understand. Now, we need to own the problem. We need to understand that you can go online, but before you do anything, before you change anything, check with your healthcare provider. Some of the information out there is great. Some of it is not great. The question is, how do you know which is which? That's where your doctor, your nurse practitioner, your healthcare provider can provide you with the best information that works for you. We're not all built the same. So your therapy needs to be individualized. I'm Dr. George Flinn. Thank you for watching. We'll see you next time.